Cardiac arrest, also known as sudden cardiac arrest, is when the heart stops beating suddenly, and this is due to lack of blood flow to the brain and other organs in the body. This can cause a person to be disabled, to die, or lose consciousness if not treated immediately. Often, cardiac arrest will occur without any warning signs, and this will cause a person to faint or become unconscious. So, I'm going to be talking about the risk factors of cardiac arrest and then how to prevent it. And also, I'm going to talk about if you are beside anybody suffering from cardiac arrest, how you can be of help to the person. I'm going to talk about all those things in this video. So sit back and watch this video to the end. If you are just joining, thank you so much for coming. And if you have been here before, thank you so much for watching. I really do appreciate it. And don't forget to like, don't forget to give a thumbs up, and don't forget to subscribe to this channel. So without much talk, let's run through the risk factors of cardiac arrest. Number one risk factor is men over 45 years of age. Men over 45 years of age are more likely to have cardiac arrest compared to women of that same age or younger men. Number two, those with family history of heart problems such as coronary disease, high blood pressure. In one of my videos on this same channel, I've talked about how you can prevent hypertension as high blood pressure, and then I'm going to be recommending that here. You can see it here, so just click and watch. You're going to learn a lot from the video. Number three risk factor is foods with high cholesterol: red meat, beef, pork, processed meats such as sausage, whole milk, fried foods. If you consume all that a lot and you are a man above 45 years of age, you should please watch it, because that is a common risk factor of cardiac arrest. Also, tropical foods such as palm oil, granite oil. Thank God that you can find some granite oil that are of no cholesterol in the market now. Please go for those ones rather than going for the ones with cholesterol. The next risk factor is obesity. Another one is sedentary lifestyle, smoking, excessive alcohol intake. So if you do all these things, you are at a high risk of having cardiac arrest. So I'm going to be talking about how you can prevent it now. How to prevent cardiac arrest. Number one thing is identify your risk factors and work on them. If you can identify your risk factor and work on them, then you're going to lower the risk of cardiac arrest. And then number two is taking food with low or no cholesterol. These foods include fruits, they include vegetables, they include avocado, okra, vegetable oils with no cholesterol. You can go for them in the market. So another way to prevent this is you should try to snack on fruits and veggies rather than all those biscuits and chocolates that you consume. Then another one is choose fish instead of meat. Instead of red meat or processed meat, choose fish. Fish is very okay. So if you are suffering from high blood pressure, make sure to use your drug religiously. You can check here for how you can lower the risk of high blood pressure as well. If you are living a sedentary lifestyle, make sure to exercise regularly. Please exercise regularly. Sedentary lifestyle will not benefit your health, it's just going to cause damage to it. And then the next is avoid any tobacco products. Avoid tobacco products, stop taking alcohol, and stay physically active. Then the next thing is call your healthcare provider if you have warning signs. If you have warning signs such as fainting or chest pain, that might signal a higher risk of cardiac attack. If you are seeing these warning signs, make sure to contact your healthcare provider immediately. So let's move to the last phase of this video, which is if you are beside someone that has cardiac arrest. This is what you should do immediately. Number one thing is to check for responsiveness. Shake the person, and if you can call out the person's name, or if you don't know the person's name, call for help and then take the person to the nearest clinic immediately. So I want to encourage you as well not to give up on your diet. Even if you're on medication, make sure to stay healthy with your diet, as this is going to support the treatment and help lower the risk of cardiac arrest. I hope you enjoy watching this video. See you all in my next video. Thank you.